you're all at the right place at the right time. The aesthetic market, and I checked the statistics and the numbers today, currently worth $53.3 billion. That's with a B. So you're in the right place at the right time. So I guess you need to sign up for next year. So hopefully we'll get up to $60 billion. But it's all driven by the physical wellness and the well-being. People want to look good and feel good, and they're working longer, unlike other markets in the medical field. So after 30 years of consulting, I see the growth, I see the trends. I know the stock market is up and down, but this market is way up. So stay tight. And our first doctor who has an amazing success story, and it can be the same story that I could be talking about 3 years or 5 years from now for you. Dr. Tsay from California. He's actually the top Allergan injector. So I applaud you for that. He's amazing. He's made it so far. 3 years ago, in 2015, he actually was a student sitting here just like you are today. And he's come this far. He's very famous in California and now nationally. And you'll actually get to see him inject. He's going to do a demo of a jawline, reshaping the jawline. And I must tell you, as you age, not that I'm aging, but as you age, the jawline, the neck, it's the first thing that goes. I mean, we look in the mirror from here up, forget about from here down. That's another story. So he's going to work on the jawline, which is great, and it's something that all of you really should pay very close attention to. But his results are very natural, and that should be your goal, natural results. Nobody wants to look overdone. And the fact that you can offer non-surgical procedures to make people look and feel fabulous is amazing. And most of what we do here is non-surgical. So right now I'm going to introduce Dr. Tsay to you, and I guess his model is now coming up. Magic on the stage, Dr. Tsay. Thank you. Thank you very much.
Hey, thanks for the introduction, Cheryl. So, gosh, 3 years ago, I was right here sitting in these same chairs as a student. I can't believe as a student. It's been so long. I still remember being excited to try to learn as much as I could, as fast as I could. And I remember how cold it was to fly from California all the way to New York City to try to learn something brand new. But I did, and I went all in. I put all my chips on the table and went all in. In fact, I even quit my full-time job as an ER doc, and now I'm practicing as a full-time aesthetic provider. So I'm really, really honored to be here on stage to talk to you guys. So how many of you guys are here want to learn some new injection skills? Raise your hand. That's awesome. Okay, all right. So if you can just pick up 1 to 2 pearls that you can bring back to your practice and implement into your business, into your art, that this trip will be worth it for you. How many of you think you can at least get like 1 or 2 little pearls? Raise your hands. Excellent. When you're looking at the injectors today, pay attention. If you're not a detailed-oriented person, become a very detailed-oriented person, because it's all in the details. Pay attention to every aspect. Pay attention to their body language. Pay attention to their stance. Look at the opposite hands. Look at how fast or slow they're moving the needle or cannula. Look at what they're doing with the other hand, because they could either be tenting the skin, tapping the skin to distract the patient. There's all these little details that you're going to pick up on. And in fact, that's how I got the best learning, is by watching and watching other injectors and learning. So you can call me a voyeur, and I'll take that. This slide just shows what's called the gonial angle. This is the angle from the inferior border of the mandible to the posterior ramus of the angle. You kind of want to evaluate that in your patient. A good, I guess, an attractive gonial angle would be probably between like 105 to 120. That's debatable, but that's an attractive gonial angle. So the anterior border of the masseter, just above right there, that's where the facial arteries. That's the danger zone. You just don't want to go near there. If I do go near there, I'm very superficial. I'm like subcutaneous or subdermal right there. Okay. So I've got my cannula, and I've kind of measured out. You can kind of measure out like where the tip's going to be. It's going to be this way. I would kind of like to shorten that angle a little bit. So I'm going to make my porthole right here, but then I'm going to be very superficial right here. So I'm going to go ahead and make my porthole 25 gauge, 2-inch, 1.5 to 2-inch cannula right here. I'm going to be using radius, so that's a good question. For the jawline, I like to use something with a high G prime, something that's going to project. So today they have radius. I've used everything, including I do fat grafting, so I put fat there, I put Bellafill, I put Radius, I've used Voluma, I've used Wrestling Lift. I mean, you can use any of those products, but today I have Radius, which is a very good product. So I've measured out kind of where the extent of my tip of my cannula is going to be. I'm going to make my porthole right there. So another little tip, how was that? Did you feel very much pain? Not at all. She didn't feel very much pain at all. So another tip, instead of going forward and jabbing the needle with your hand, with your right hand, if you can pull the skin up towards the needle, they tend to feel less pain. So that's a cool little trick that I picked up. And it's bleeding a little bit, so I'm going to hold a little pressure. So I'm just using my non-dominant hand. I'm kind of guiding the cannula here. This gives me a little resistance, so the cannula is somewhat bending, but you want to try to keep it as still as you can. And I'm going to use my non-dominant hand to kind of tap. And I just do very, very slow injections. You can stay out of trouble if you just keep the injection quantity small, not huge boluses. I'm gonna go back and forth in that same spot and just keep going at it. You doing okay? Check back in with the patient every now and then. You're gonna gradually see that jawline. And you can use your non-dominant finger. You can mold this product. It's pretty stiff, and I mean, it looks like, it looks and feels like toothpaste, but you can definitely mold this product. And again, right here, the facial artery is there, but I'm very superficial to it to stay out of trouble. And you don't want to be too superficial. You don't want to be dermal with this product. Do you know the difference between Radius and Radius Plus? Okay, so the Radius Non-Plus does not have lidocaine. The Radius Plus has lidocaine. So if you're mixing liquid lidocaine with the non-Radius Plus, you're actually lowering significantly the G prime factor, the lifting factor. So, the Radius Plus actually has lidocaine mixed in. It's pre-mixed, but it's powdered lidocaine, so they maintain the lifting ability. Does that make sense? So I've used majority of the 1.5 cc's of the Radius here. Can you guys see it's kind of starting to form? So I'm going to switch out the cannula, and I'm going to use a needle for that angle, the gonial angle. I'm going to go with a needle. And one little tip I'm going to suggest that you do is to keep a finger pressed against the inner aspect of that angle. So you don't want it to go into the neck and have like a extra lymph node below the angle. So you want to keep that finger there so that product doesn't migrate. So I'm injecting Radius Plus, but I'm going right on the periosteum, right at the angle, to give that final definition of that sharp, crisp angle. So I've used about 0.2. And I've got a little bit left, 0.1. So sometimes what I can do is I'm gonna go vertically up this angle right here. Can you see that on the screen? I'm gonna go vertically up here with a needle and just deposit a little bit vertically to give a little bit more definition. Again, I'm subdermal to subcutaneous here and moving the needle back and forth. And that's one syringe, which is 1.5 cc of the Radius Plus. A little tip, and if it's getting hard to cannulate the porthole with your cannula, you see my right hand, I'm kind of twirling the syringe with my fingers and kind of rotating it back and forth. That helps a lot of times. And so you can see, it's a blunt cannula, you can see the tip. Can you see the tip there? Went right there. So it's coming out, but it won't pierce the skin, so you don't have to worry about it going through. But if it goes through, it's okay. It's still a cannula. No, I go back and forth. I think it's safer that way, and it's less prone to error if you just put a little bit of a time and you just kind of continue to deposit product there. The Radius is calcium hydroxyapatite. It's very stiff. It's got probably one of the highest G prime on the market. It's made of similar structure as your bones, and it's thick. If you squirt it on your finger and you play with it, it's like toothpaste. I mean, never tried to brush my teeth with it, but you know, you could probably, it's the same consistency as toothpaste, so you can play around with it. In fact, try to do that with the different fillers. You'll feel the different properties. They all behave differently, and so, you know, I use all different kinds of fillers. I don't have, you know, certain ones that I am limited to. It really depends. So for the jawline, it's specifically like a high G prime product. What's the question back there?
How long is it effective?
Per company, Dr. Aguilar, they say what, a year and a half to 2 years?
Anything from 9 to 18 months.
I tend to be a little bit more conservative when I set the expectations a little bit lower. Because if you tell someone 2 years and it lasts a year, they're going to be disappointed. If you tell someone 8 months and it lasts a year, then they're going to be pleasantly surprised. So I tend to set the expectations a little bit lower, so that increases the chance of their satisfaction. You doing okay, Kim?
Yeah.
Yeah. So I'm still just putting down different layers, kind of building that angle. Radius does tend to swell. There's quite a significant amount of swelling involved. So you're going to have to advise them that post-procedure, you know, what they see is not going to stay like that. There's going to be some decrease. That can be good or bad. They may like or love the swelling, or I've had some people freak out from the swelling. This is just way too much. So you just have to educate them so that they're aware that there's some swelling and the swelling will go down. And if they need more, they can just come back for more later. One little pearl, this is beyond the scope of today's injection, but as I'm building her jawline, if someone has maybe mild jowling here, if you add a little bit in the chin here, what you'll do by doing the jawline and adding the chin, you'll actually, can you see this? It'll pull the jowling back. You can kind of reduce the appearance of the jowling. The speed of injection is important because you don't want to be too fast. The problem with radius too is you can get a little bit of resistance. So you got to be very careful. Sometimes it'll be a lot of resistance and it won't come out, and you'll keep pushing, and then a lot will come out. So you got to be very careful because that a lot come out. You don't want that a lot come out into a vessel. So I'm going to also go in subcutaneously at the angle, build this posterior segment here, 1, 2, 3. And I'm going to keep the needle moving. I just like to keep the needle moving, and that way I am not bolusing a lot in one place. Does it look okay? Yeah. Can you see a difference?